Welcome, welcome, welcome back, my Be Health Empowered family, to another episode of Excuse Me, Doctor, with Dr. Mel. My name is Dr. Melissa Clark, and of course, please call me Dr. Mel. Welcome to all the newbies who are tuning in for the first time. We are happy and delighted to welcome you to the Be Health Empowered family. And if this is, again, if your first time watching, please go ahead and hit that red subscribe button if you're listening to us on YouTube. And if you're on Facebook, please hit that like button. We really, really appreciate you for it. Of course, for everybody who tunes in all the time, my Be Health Empowered family, you know that in order to have an amazing week and do what we do here, which is to empower you with the health information that you need to make sound health decisions for yourself, your family, and even your community. In order to do all of that, I have to have my co-host with me. So come on in, y'all. Lila Mays, Wayne Bruce, welcome, welcome. How y'all doing?
Good.
What's up, Dr. Mel? What's going on with you?
Hey,
Hi,
nothing much.
everybody. It's like I just saw you in real life.
I know. So full
Somewhere in
disclosure,
this lifetime.
we did our first photo shoot ever.
Oh, look.
And we're
it's
gonna be
coming.
having a whole new look, promo look. It's gonna be exciting. Watch for that, y'all.
Watch out for it. It's coming. I'm excited, Dr. Mel. I mean, it's been one of those days where I've probably had too much caffeine. So it's one of those days. Pray for me, okay?
We will.
All right.
So what's up for today? What we get into today,
Look, y'all ought to know it's Women's History Month. I know that. You know why I know that? And every man should know it's Women's History Month, right? Because we are the husbands, the boyfriends, the brothers, the fathers. We are
the sons.
The sons. And so we need to celebrate y'all. You know,
that's right.
So
every day.
I'm excited.
Every day.
I'm excited about it. You know, celebrating Women's History Month. And I think we got the great topic, don't we, La?
We do, in fact. Today's topic is Empower Her, Women, HIV, and Sexual Health. So you all have to stay tuned because we have two amazing guests. One who, through her lived experience, is going to share how she's changed the lives of women through education and advocacy. And then another young woman who is going to talk about how she really engages people, young women period, to know their HIV status.
Wow, it's exciting. Right. That's exciting. I'm Mr. Technical. I hate to interrupt Dr. Mel, but can you move that mic closer to you?
Sure. Can you hear me any better now?
No, that's Lila. That's Lila.
Okay.
You cut it off, Lila. Oh no. There we go. Yeah. So
all right. Well, now that we have that together, we're not going to learn not just about HIV and the signs and the symptoms and the treatment. We're going to do all that. But because we have these amazing women guests, we're also going to hear what works when it comes to prevention, because in our community, in the Black community especially, our numbers of people, especially Black women with HIV, something has to be done about it. So we're going to hear about all of that. It's going to be a great show, y'all. Make sure you tune in and stay tuned in.
It's going to be a great show. But before we do that, we must go to the week that was in health news, right? Health and wellness news.
Our weekly recap. Bring it up.
So look, like I said, it's Women's History Month, and we must celebrate all the women, but we're especially taking a look at the women in health and wellness in the health field. Who you got, Dr. Mel?
So I have a shero that I just want to introduce to everybody in case you have not heard of Dr. Jane Cook Wright. She earned her medical degree in the 1940s and 50s, and then she went to work in cancer research. She actually her research led to essentially a medication that helps in the treatment and remission of blood cancers, lymphoma and leukemia. That's huge. She headed up cancer chemotherapy at NYU Medical Center in New York. first Black person to do that, and her research helped change chemotherapy permanently. It used to be like a Hail Mary kind of last resort kind of thing, and now it's the first thing that we do, and it is successful in many, many cases, and that's all due to a lot of the work that she did. So I am, yes, absolutely. We are hailing Dr. Jane Cook Wright this month for Women's History Month.
Awesome.
All right.
That's
Yep.
awesome. All right. So, on another note, we are going to talk about a social media influencer who just passed away, Jessica Petway. She's a young lady, big fashion, hair. She was a big influencer. And the thing that is really difficult about this story is she was misdiagnosed after 2 really life-threatening vaginal bleeds. So she was diagnosed with fibroids when actually she had cervical cancer. Yeah. Go ahead, Dr. Mel.
Well, I was just saying, you probably wondering, well, how could that happen? And essentially, they treated her as if the vaginal bleeding was something that didn't need to be investigated further and could be chalked up to fibroids, rather than doing the actual work of diagnosing what she actually had. And I really just wanted to highlight, thank you so much for introducing what actually happened to Miss Petway. I wanted to use it, and definitely condolences to her family, and all those that loved her. I want to be able to say that her life wasn't, or the way that she died was not in vain, right?
Yeah.
Because there's an opportunity for us to understand that cervical cancer, if caught early, is treatable and survivable. That's
Mhm.
why it's important to have pap smears. It's now recommended that we have pap smears every 3 years between the ages of 21 and 65, especially if you're sexually active. And sexually active doesn't mean, you're having sex a lot. It just means if you have sex at all, okay? And then heavy bleeding is never normal. Don't let anybody tell you, oh, that's just something that you expect as a woman. It's not normal. 2 tablespoons of blood per period is the average, right? And so the medical system failed her.
Yeah.
But I want us to all know that never accept feeling bad as the norm. She was so exhausted that she fainted almost a couple times, required 10 units of blood before she was actually diagnosed. So if you're told that, get a second opinion and insist on a solution. Fibroids are common, right? But that might not necessarily be the explanation. Make sure that the ultrasound is done, and that pap smears are done, and that all the tests that should be done are. So thank you to Ms. Petway for allowing us to use this instance to really make sure that everybody gets these messages.
Yeah.
Wow.
And blessings to her spirit.
Wow. It's just truly sad that we lose a sister like that. It's just truly sad. I mean, I don't know what to say as a man. We sit over here, and so many people, so many men want to make decisions about women's bodies. That's another story. That's another story. We don't want to go down that route. But I mean, it just makes me as a man just think, man, there's so many things that can happen to women dealing with their bodies, and take some responsibility. If you want to take responsibility for something else, how you want a woman to handle her body, take responsibility for that too. You're gonna take responsibility for that. I don't know, that's just something in my spirit. But I'm going to move the conversation to number 3.
Well, before you move on, I just want to say, everyone needs advocates, and that's also a way that men can help the women in their life, and vice versa. Being an advocate for your loved one when you go to the doctor and it seems like things just don't sound right.
Yeah. Wow, look, I forgot what I was going to say. No, I didn't. There's a cheap alternative. Move for better memory, Dr. Mel. I'm excited about that one. One, I'm excited because I'm cheap. Two, I'm excited because I need better memory. And so tell us about it. Explain it to us.
So this is the deal. There was a new major study done in Britain that showed that people over 60 who took a prebiotic supplement for 3 months had half the errors on tests of memory and cognition than people who took a placebo, essentially took something that wasn't active.
Well, we
And
know that.
that's huge.
Yeah, we know we had Dr. Chutkin on, and she talked about the connection between the gut and the brain. So it was covered in that microbiome episode. Go back and look at it. YouTube, Facebook.
Yep. And so we know the microbiome is the collection of bacteria and other life forms that live in our gut. As much as we might not want to think about that, there are other life forms living in our gut, and they have significant connections to the health of our brains. They have a link to a lot of different nervous system conditions: autism, anxiety, obesity, schizophrenia, Parkinson's disease, Alzheimer's disease. So there is this connection between what's happening in our gut and what's happening in our brain.
Now, I've taken probiotics, and we hear about probiotics a lot. Explain to me prebiotics.
So those are living bacteria. Probiotics, let's start there. Those are living bacteria that you can take as a supplement to restore the natural balance of bacteria in your gut. Studies have shown that these too can affect the nervous system in a positive way when they're in balance. Prebiotics, though, are the food components that these other life forms in your gut feed on, right? So if you take the right kind of food into your body, mainly plant-based foods and vegetables, fruits and vegetables, you're giving the sort of the nutrients that they need to thrive, right? The right kind of bacteria to thrive. Now, you can get them from, like I said, eating fruits and vegetables, or you can take a supplement. The reason they use a supplement in this study was because they wanted a standard dose to be able to say, yes, everybody got the same thing. And also, as people age, sometimes they lose their appetite, so they're not getting in enough fruits and vegetables. There's dentition issues, with, people who don't have dentures and may have lost teeth, being able to chew, right? So by taking a supplement, they eliminated all those issues. But for everybody else, focus on a plant-based diet, getting in enough fruits and vegetables.
That's great. So dentition is different than mortician. So I just want everybody to know that.
Yes. Yes, it is.
So, if you don't see the dentician, you will go see the mortician quicker than you think.
Listen. Right. That's next week's episode. That's a good teaser.
Right.
We're going to be talking all about that next week.
I'm early. I'm sorry.
Yeah.
I'm sorry.
So what else? We got the weekly recap. What's next? What y'all think?
Love that.
So what you got for us, Sly?
Listen, your girl was stuck in airports and on planes and snow and ice and all kinds of things. So we're going to do an on-air what y'all think. All right. So since I was on this airplane yesterday for 6 hours in Minneapolis, Lord Jesus, we were packed in there, right? I mean, packed
like
in there.
Sardines.
Like sardines. And I was in an exit row, which was supposed to have extra leg room, but that's a whole nother conversation. But it got me to thinking this. Should airlines be continuing to shrink these seats? And I'm a curvy girl, so I need a little space on the plane. So here, it's a two-parter here. Should larger body people have to pay for extra seats? Or should airplanes make accommodations? Third part, should they still be shrinking the size of these seats?
I want to know what y'all think.
That's
right?
what we want to know.
Hey, I can tell you what, I can't even curse on here because this is a show that does not curse. So look, I'm offended that y'all want to ask the little bigger body people, because I'm a wide body. I was big boned. You know, my parents told me my bones were heavy. They ain't ever tell me I was fat. Okay, I had to shop in the husky section when I was a child. Y'all don't know about huskies, but anyway, I mean, you gonna charge me because I'm wide?
Well, but if you're taking up 2 seats, should you be charged? Should they be charging for 2 seats, or should they be making them larger? Should they be making the seats larger? Dr. Mel is going to get into
so I think there's actually a health related issue to this. Number one is safety, right? Because if you make the seats too small, if you have to get out of the plane in a hurry, it makes it more difficult to do that, regardless of what size you are. And you should be exiting within 90 seconds, I think. And then the other thing is, it puts you at higher risk. If you can't move around, it puts you at higher risk for blood clots. And, you know, I have taken care of many a passenger in the emergency department, you know, who made it off the plane and then unfortunately had a blood clot that broke off and went to their lung, which is a life-threatening condition called a pulmonary embolus. So, you know, too small seats make it so that you can't move, which puts you at higher risk for these blood clots forming in your legs on very long flights. We're not talking about, you know, the little hop for 45 minutes. We're talking about 6 hours and more. So still very important to get up and move around while you're on the plane, regardless of the size of the seat. But the seats should stay what they used to be, which allows people to move around safely and move, you know, get comfortable in your seat and adjust your body so that your blood isn't pooling and causing blood clots.
So look, I want to hear what people have to.
Exactly.
I want to hear what people think. Put it in your chat. Put it in text me. Well, don't text us. I don't want text from everybody. Put it in the chat. Put it in the chat or whatever. And look, let's come back to this next week, because this.
All right.
I mean, can an airline be held liable for someone larger who can get blood clots or something?
I don't know. We'll have to come back to that next week, because we have to get into our show for tonight. Yes. So I'm going to see y'all back in a little bit, but we are going to move into our topic tonight: empower her, women, HIV, and sexual health. So folks are out there living their lives. They're making up for lost time during the pandemic. And unfortunately, it seems like less attention is being paid to sexual health and preventing sexually transmitted infections, including HIV. HIV still is being transmitted predominantly from unprotected sex and sharing needles. And people of color are getting infected more. Hispanic and Latino people aged 13 and older, 18% of the population, but 25% of people with HIV. Black people, 13 and older, 12% of the population, and 40% of people getting HIV. And as I mentioned before, Black women are disproportionately affected by HIV compared to women of other races. So the good news, though, is that the rate of new HIV infections among among the population is not increasing, but Black women remain 10 times more likely to get HIV than Black women and 4 times greater than Latina women. So it's really important to continue to get the word out about HIV prevention, advances in care, especially in communities of color. And tonight we have 2 incredible guests who are going to talk to us about this topic. Number one, we have Deirdre Johnson. She's worked as an educator, a case manager, and a speaker who used her lived experience with HIV for over 20 years to promote healthy life choices on her platform, Deirdre Speaks. She's an activist and co-founder of Ending Criminalization of HIV and Over-Incarceration in Virginia, which is ECHO Virginia. So welcome, Deirdre. Thank you so much for joining us. So glad you're here.
So glad on so many levels to be here, and this is an amazing topic. Even today, I honestly just got a call about someone who may have been exposed to HIV and how we can even help them today.
Wow.
And
Wow.
even like even from our call that we had yesterday, there's some stuff that
Yep.
happened
We
even
got
from our call.
we have a lot to get into. And so we're also going to introduce our second speaker before we get into it, and that's Sarah Prince. She is a dedicated community health worker at Access to Holistic and Productive Living, Inc., who brings 5 years of invaluable experience in public health to the forefront with a focus on critical issues that face young people, especially HIV. Welcome, Sarah. Thanks so much for joining us.
So, yeah, I'm so excited for this episode. It's a great topic, great conversation. So I'm looking forward to getting into it.
Wonderful. So, Deirdre, I'm going to start with you. Can you please tell us your story? How did you decide to become an advocate and an educator in the HIV space?
It has a lot of layers. At the end of the day, the one part is as I was given birth, a bunch of people, like I literally had the anesthesiologist yelling them down the hall, you know, you got to be careful because she's HIV positive. So from
What?
that moment, from even the case manager came to me and said, hey, Deirdre, I was a pre-med major in college, and she said, hey, look, here's some information I want to share with you. You look into it. And I was able to understand that, and also knowing that there were other individuals that were coming from English is not their first language. That part, and just that part. And then as we move along, and even today, that we have some people that didn't expect HIV criminalization to be happening to them, to being a parent of a non-gender conforming person, to the possibility of their children even being criminalized for being non-gender conforming and some other stuff. So I come to the space in a array of spaces. So thank you for having me.
Absolutely. And it sounds like you said, there are many paths that led there. Tell us, what is HIV criminalization? What do you mean when you say that?
Thank you. Honestly, HIV criminalization is at its very simplest. If you are a person living with HIV, you are able to be criminalized based upon your HIV diagnosis. So at the simplest form, if Doc, you and I are friends. However, you and I decide to, get into a fight, and you and I get into a fight. And as we get into a fight, and you decide to say, hey, Deirdre, I initiated the fight in the simplest form. And you say, hey, Deirdre, started the fight. And because I'm a person living with HIV, other charges can be added on. And so even though I'm going to go with, even though, you and I both know I would not do this, but this is a hypothetical experience. I slapped you, and just in the slapping, there is nothing that would create
No skin breakage, no bodily fluids
exactly.
exchange. Right.
But
Wow.
because I am a person of lived experience living with HIV, you, depending on the state, can say she is a person living with HIV, and aggravated assault charges can be added on.
Wow,
And that
that's
is
amazing. And then
depending
I
on the
talked a
state.
lot about, yeah, that's eye-opening. I talked a lot in the introduction about Black women being the fastest growing group of individuals with HIV, and those who identify as women who are Black. Why is that?
I wish
I
I
know
knew the
that's
answer.
not a simple. It's not a simple question.
I'm gonna give it its honest form. Is races and other races systematic pieces. It's a racist format that we, as people that look like three of us presenting today, we did not create those pieces, and it is that part. So it is based upon racist principles. It is based upon other pieces that do not include you, I, and everybody else in between. That is why we are where we are. And although I'm not saying that we should get rid of all those things, because there are a space where there are criminals that do criminal things, and we do need to, deal with that. But it's based upon what you and myself, all three of us are racist principles, period.
Mm-hmm. So, in other words, the social conditions created by racism put us at higher risk based upon economic stability, educational opportunities that shape our life circumstances, right? Um,
Period. And I live in Virginia. That is basis upon whatever else everybody else did and does. So I have to also recognize that part, is that I live in a space, not necessarily a privilege, but a space that also condition other states and other people in other places to be where they are, because we are the center of racism. Like we are the like I can't
having
say it,
grown up in Virginia, I have no argument for that statement.
like we
So
yeah.
yeah, yeah. So Sarah, tell us about the work that you do with young people, whether it be on college campuses or otherwise. Would love to bring you into the conversation. Understand, what are you seeing out there uh, in with young people when you talk with them about HIV?
Yeah, so my background is in public health. So I initially got involved in 2020, right after I graduated from college, as a community health worker at Access. And so our organization, we do a lot of work in the community and on these campuses just to raise awareness about HIV prevention and also just promoting sexual health among the students. And so I feel like a lot of times it's really good to go to the campuses because you already have students that are looking to get involved, do things. And so it's really important for us to kind of reach out to the students in that educational setting to just provide them the information that is essential to them. So we've been partnering with a lot of colleges. We've been partnering with a lot of the fraternities and sororities on these campuses, which is a great marketing tactic that I've seen has worked because it gets people out.
That's great. How did you get involved with this work?
So I actually initially got involved with my internship. I studied abroad in 2020, in the beginning of 2020, before COVID, in London. And I was working with youth that were trying to finish school. They were trying to get off drugs, stop using alcohol. And I found myself really seeing the passion with that and really working with these people that are, at risk. And so with that, COVID happened and everybody was looking for jobs. So I just reached out to my professor and said, hey, I'm looking for something in this space. And she connected me with this organization, and it's been great.
Wonderful. So in your experience, are young women getting the message about HIV prevention on college campuses? And if not, where are you seeing the gaps?
I mean, I see that there are gaps that need to be addressed. I feel like you said with the stats that you mentioned earlier, a lot of progress has been made over the years, but there's still quite a bit of work to be done. And just to ensure that all young women have access to this comprehensive sexual health education. And I think we need to kind of tailor our approaches to resonate more with their specific needs and challenges, as whether in to each cultural group. So like she said earlier, Black, African American women, Hispanic women, all different backgrounds, we have to tailor that approach because it's not going to resonate with them if they don't understand what we're saying. And so I also noticed that there's a lot of misconceptions that women and young girls are not getting HIV. But as you mentioned earlier, like in 2018, of the 1.1 million people that were living with HIV, over 250,000 of those were women, which is 23%, which is a high number.
Wow.
So, yeah. there's definitely gaps that need to be addressed. And I think it starts with the youth. I think, the youth, social media, they spread the word about everything. And so I think that is a great way for us to get the word out and just for people to know their status.
That's wonderful. And so, Deirdre, I see you are, applauding
Yes.
what Sarah is saying. Yes. So, there've been some advances that have happened in HIV prevention that a lot of people might not know about. Can you sort of tell us what that is? And let's just start off with telling us what are some of the advances in HIV prevention.
Well, one piece for sure, and I think Sarah can also agree on, is there is a thing for PrEP. PrEP is pre-exposure prophylaxis, and there's one or two things. You can either take a pill or you can take a shot, however that shot presents for you. But it is available for people that look like us. And a lot of times, a lot of Black women, and when I say Black women, cis Black women, women that identify as women from birth, think that the what's the word I'm looking for? The commercials don't apply to us, baby. Like they do.
You're talking about the
They
commercials
apply.
on TV, right? And
Yes,
they often feature gay men, right? Yeah.
Right.
Yes. So
All the
don't get
time.
it twisted because they apply gay men or trans women or women of trans experience, men of trans experience, that they don't apply to women that do not identify as women from birth. They do. And boo, it applies to us too. I share with you, like Doc, like even from our conversation that we had yesterday to today, 24 hours of I literally had someone reach out to me that is a woman who was born woman at birth, that long story short, she has now been transmitted HIV from a person. And long story short, she is even in the midst of trying to figure out on criminalization issues and everything. So let's not get it twisted that in 2024, that HIV transmission still does not happen. Although we would like to get to what the government would say EHE was ending the HIV epidemic in 2030, that shit cannot happen.
Right.
It will
So,
not happen.
yeah. So what is the concrete advice that you're giving to women? I define the term sexually active, right? A lot of people think that sexually active means I'm having a lot of sex, right? But what do you tell women who do have sex about, getting themselves tested, getting their partners tested, especially at the beginning of a relationship?
Well, one, don't always
And
fully.
that's for both of you. So you start, Deirdre, and then we'll go to Sarah.
I'm sorry, Sarah. I kind of jump in. One, let's not put the onus on our partners. Let's think about self first. And my grandfather was a person that had a sixth grade education, and in my eyes was the smartest person I ever knew. And he always said that when you point one finger out, there are three fingers that are pointing back at you. So what are the three things that you need to figure out for you? And one of the three things as a person that, although I'm living with HIV, and if I was a person not living with HIV, have I got tested? And if I have, what's the next thing of prevention that I've done for myself? Whether that's PrEP, condoms, abstaining, whatever that shows up for me. I've also looked into mental health for me, or just health for me. But I've looked at those three things back before I've said that you were the person that did. So this is self, and we've done our self moment. And in that moment, we've done that. And as we have done that, we have explored all of the options that are available for us, whether it's abstaining, whether it's PrEP, whether it's condoms, whether it's anything else. So I want women, or not only women, people, period, to know that there is PrEP, which is pre-exposure prophylaxis, and you have two options. You either have a pill or you have a shot that you can get, and you explore what is best for you. And that's the only part that I would suggest for people going forward. And I move to Sarah and and share that with her.
Yeah, that's great. So for me, a lot of the times, kind of echoing what Deirdre said, we really emphasize just the importance of knowing your status just for your own health and for the health of others. I mean, we all are trying to eat better and go to the gym and take care of our mental health, but getting tested and seeing your doctor and doing all those things is also, a proactive step towards taking control of your health. And a lot of times the signs and symptoms of HIV, fever, fatigue, sore throat, headache, okay, I get that every day. So I'm just like, okay, you can't just use those symptoms to say, okay, I have something. It's important to get tested regularly to know your status. And that's how I get my youth. I always list out the symptoms and signs, and they're like, well, that sounds like the flu, or that sounds like COVID. I'm like, yeah. So it's important for you to get tested and just make sure that you know your status.
I think that those are excellent points. And I have one other question. Probably I'd love to hear what both of y'all have to say. How much of caring about our sexual health is tied to our sense of self-worth? You mentioned mental health earlier, Deirdre. If it is, how can we get to the root causes of that self-worth issue if we don't talk about mental health?
Well, first and foremost, we need to make sure that we understand, especially as people of color, mental health is not a negative thing. It is a positive thing. Like, it has helped me to get and helped us to get in spaces otherwise. And then also, when you're going to your doctor, like, your doctor should not just be asking, how are you? They also need to be asking, how's your sexual health? Like, are you, I mean, I don't know, I won't get raw like I would be in my call. But are
Go
you
ahead.
reaching no, baby. We're gonna keep it PG. We're gonna keep it PG. But like, are you receiving sexual health? Like, are you reaching orgasm? Or do you have a regular partner? And if you do have a regular partner or several partners, are you using condoms? Are you employing PrEP? If you are not HIV positive, like, hey, baby, are you reaching orgasm? Is it great? Like, like, what is your sexual preference? And not being like, oh, because you receive A, then you're in a bad category. Because
right.
I will not.
Providers have responsibilities that as providers we're not meeting because we have our own hangups, right? And our education needs to be better to prepare us to talk about subjects that are quote unquote taboo, or we've been taught are taboo, for the health of our patients. But to go back to
that's part.
our
I
conception of ourselves. Well, I'm going to go to Sarah to
as
ask.
a provider, I don't want you to ask, are you a top or a bottom, or do you receive, do you give, like, at the end of the day, I would hope as a provider you would say, are you having pleasurable sex that is safe for you and your partner?
Right. And I think providers need to take more responsibility. But since we're not just talking to providers, we're also talking to just the general public and women out there. I would love to go back to that question about, how much of us taking ownership for our own sexual health has to do with self-worth. And Sarah, what are your thoughts on how we can address that, or how you might already be addressing that in the work that you're doing on college campuses to empower women when it comes to their own self-worth and therefore their sexual health?
I mean, I think that, you know, taking care of your sexual health is extremely important. And like we said earlier, we're just at such a high risk for not even just STIs, HIV, but everything. Every time I research and look up different things, it always says Black women are, you know, at the forefront of this and that. And so I think that, yes, it is a part of your self-worth. I think that taking care of yourself includes taking care of your sexual health, your mental health, spiritual, whatever you believe in. And I think that that's something that we need to address moving forward.
Yeah.
So you also mentioned too, you know, and wonderfully, I'm glad you called it out, those symptoms that are associated with, you know, we've talked about prevention. Now let's say that you do have an early stage infection. Seems like it could be like the flu, right? Body ache, swollen lymph nodes. And then it can progress to, after you get over that initial phase, to a chronic phase where you might not have symptoms. And even that initial phase, you might not have symptoms. But then untreated, it then can progress to AIDS, right? Which is the full-blown syndrome, which is life-threatening. How many people know about this concept of, if you are able to get down to undetectable, that you cannot pass on HIV to others? How do people understand that, you know, it is now can be treated like a chronic disease, something that you can live with, and have a good quality of life, and
I mean,
actually have partners?
yeah, I mean, still to this day, we just had our event a few weeks ago at Bowie. A lot of the students weren't aware about that. Deirdre mentioned PrEP, but there's also something called ART, which is the antiretroviral therapy. So that is an HIV treatment that's just been revolutionized for prevention. And so taking that can suppress the HIV virus that's in the blood to be undetectable, which is U equals U, which can greatly reduce the risk of transmission to those sexual partners. And I have a degree in public health, but I did not know that even when I first started doing this kind of work. I did a lot of trainings and a lot of researching on this information. So I think that it's something that we should be sharing. A lot of times on our social media, we share that. We try to get the word out. We have like pamphlets and literature that we, you know, give out. So I think it's something that definitely needs to be highlighted more.
And what's crazy,
so you're absolutely right.
is,
And so sorry, Deirdre, I was going to go back to you, but sorry, you were about to say.
So I'm a woman living with HIV for 23 years. I found out my HIV status while I was pregnant with my youngest. And even though U equals U, undetectable equals untransmittable may not say the research 23 years ago, but I also recognize 23 years ago in making sure that if I was at an undetectable status with my youngest, my youngest child, that I could also not transmit to my kid as I was giving birth. And so I'm also a U equals U ambassador, and they may not necessarily authorize me to say that in what I just said, but I recognize as a woman who was about to give birth that, hey, if my undetectable status was at an undetectable status, that I couldn't give it to my kid. And I actually had to fight, unbeknownst to you, and you all, I actually had to go through, and they told me, oh, well, you could have a vaginal birth and everything will be okay. I actually fought to have a C-section in order to even make that undetectable issue not happen
Even
to my
less
kid.
of an issue.
Right.
Yeah. Well,
Yeah,
good for you. Yes.
Yeah.
And I
Not
did know you
everybody
were
had
U equals
that
U.
privilege.
Yeah. I didn't know you were a U equals U ambassador. Thank you for bringing that out. And just so that people know,
Cool.
undetectable means that there's no trace of the virus in your system because you've been taking the ART treatment, that sort of cocktail of medications that helps, it attacks the virus from different angles. And so it can eliminate it, from your system. So yes, I can't
Yeah,
believe
and
we
that
only
was
have
even
15 minutes
before
left.
it has even
Yeah.
been, even the stuff.
Widely known. Mm-hmm.
Yeah, and even the research was even widely known. But I did know that at that moment, let's see, this was 2020, 2000. So even in the moments that were happening, it was happening even then. And so there
Right.
were a lot of folks that actually knew that. It just so happened that Bruce Richmond, and the way that he showed up in other places that people knew, like there were other
Who's Bruce Richmond?
categories. Just Bruce Richmond, pre- Prevention Access Campaign that really came up with the
Okay.
U equals U
Right.
campaign.
Great. Well, we have to bring Wayne and Lila back because I know that there are questions in the chat that they need to surface to us. And yeah, what's
Right.
going
Bring
on
it.
out there in chat land? What questions do we have for Deirdre and Sarah?
So lots of questions. I'm gonna start, Wayne, with Yvonne Smith.
Mhm.
One of her questions is, how long does undetectable last? Is it as long as you are taking the medication? But go
Question.
for it. Go for it.
Deirdre?
Answer.
That is actually a great question. So like undetectable is not one of those things that like automatically, like if you're undetectable today, put my fingers in the space. If you're undetectable today, then like tomorrow you're undetectable. It does take a minute for you to get to a crazy, where you are detectable. So I want to be very clear in that. Like it's not
Right.
in 2 seconds. Like it's not that. It does take a moment in between. So if you're undetectable today, tomorrow you're not, but 2, 3, 4 months later, yes. I also want to put that into play, but I also want to throw that over to Dr. Mel and throw that in because our immune systems are different. And Dr.
Yeah.
Mel,
So I think
the
it's the consistency of taking
Yeah.
the medication and also eating nutritiously, exercising, doing all the things that we always talk about, maximizing your health, and also taking the medication on a consistent basis and getting checked regularly to make sure that that undetectable status continues on, because
Okay.
anything can also can throw you off as well.
And also, I want to point out too that, while the risk of the HIV transmission when you're undetectable is low, you still want to make sure that you're protecting yourself from other STIs that could possibly come from not using condoms and not having safe sex. So
Right.
Exactly. And we know syphilis is on the rise and
So
exploding.
that's
Exploding.
so,
Yeah. Yeah.
that is on I think we lost Deirdre for a second. We might have lost Deirdre for the show.
No, you didn't. I was just getting my own.
So
All right. What other questions do we have? Let's
so
keep
we have
going.
a question. Syphilis is on the rise more than
Yes,
HIV.
it is. My
Are
God,
syphilis efforts prevention being tied in? I think we
yes.
Yeah.
Okay.
What's your
I think we
experience,
lost
Sarah?
her.
Okay.
So for us, I think that, that is something that we honestly need to focus on more. I think that a lot of times we don't see a lot of campaigns about syphilis or a lot of campaigns about other STIs. A lot of the focus is on HIV and AIDS prevention and early detection. So for me, to be honest, I don't see a lot of campaigns on syphilis. However, it is still very important. It's still something that we need to focus on.
And I can say that from a provider standpoint, providers have gotten out of the I won't say out of the habit of thinking about syphilis, because there's a whole generation of physicians who haven't been exposed to it. They don't know what it looks like, right? So when it does show up now, because it is on the rise, they're not recognizing it. And so that's also a factor that is leading to more syphilis. If it's not diagnosed, then people think they're okay. They go out and they have unprotected sex, and then that leads to the spread.
Yeah.
Now, can
We
y'all
have
hear
another-
me?
Yeah, we got you. We got you
Yes.
back. I got another question
Okay.
coming in.
Oh no, well,
Yvonne
I
asked.
got
Yvonne
an answer for
asked.
syphilis.
Okay, Yvonne asked, how does syphilis affect the baby when the mom is infected? I'm sorry.
No, perfect. One thing for sure and two things for certain. I can say from as a member of Virginia, at some point we thought that we had eradicated syphilis, and on a bunch of different levels. And unfortunately, it showed up in the most rural. I didn't say rural places in Virginia, in specifically Dinwiddie County. Well, I will retract that statement. It wasn't Dinwiddie, but they showed up in spaces in Virginia that we thought that we had eradicated it.
Wow!
And now it is back. And
So-
not only is it back, is it back in full force? And into the question that you asked with kids. And so there's a reason why when we have children, that the first thing that they do is put this amazing cream on their eyes when they come through because of syphilis and herpes.
Okay, Dr. Mel.
So I think also what Deirdre is saying is neonatal syphilis. So syphilis in infants is on the rise because it's on the rise in mothers, and during the birth process, coming down the birth canal, children can get infected if the mother has active syphilis going on that's untreated. So yes, and that is unfortunately one of the consequences of syphilis being on the rise.
So Lai, do you have another question? Hold on one second. I think.
Sorry, I was so into that. I was just,
Right.
That was a great question. I wanted to, this isn't a question so much as a comment about your sexual health, but it's coming up in the chat and I got a text message about it. It is really important that you are that your provider is invested enough in you that they are asking about your sexual health, and your partner. My PCP is all up in my business. And I'm not offended by it. I think it's awesome. Yeah.
Yes.
All right.
That's good.
So we are at the lightning question, and this question is like a 30-second answer if you have it. How did the pandemic affect your prevention efforts?
Let's start with Sarah.
Honestly, I would say it didn't. Do you mean like as far as outreach or?
Yes.
Yeah.
As far as outreach.
So I mean, during the pandemic, we had to do a lot of like virtual outreach efforts. So we had like bingo, trivia, that kind of thing. So we weren't able to really go out and test individuals. And for at least for my organization, we had to kind of refer them to the health department and other organizations that were still operating in person. And that kind of that can take a hold on the students because they're out there looking for ways to get tested. But I think now that, I don't want to say the pandemic is over, but we're able to, not over, but we're able to reach a lot more students now that things are back in person.
All right.
And what about you, Deirdre?
I would have to go against what Sarah said and say that it really messed up with outside of students. It really fucked up everybody. As a parent of a person that is non-binary and gender conforming, they cannot go to anybody's. Yeah. Long story short, COVID fucked up everything. And folks may think that we got some numbers, and I think the numbers that if we had to be in real time, those numbers are people that are actually that came up with HIV, STIs, and everything in between. Those numbers were aspirated simply because, let's be real, people were at home. People were doing what people at home do. And
Right.
while they were doing what people at home, and even although I'm actually going to call in some stuff that people may not really be ready for, but I'm going to go ahead and call it in because that's what Deirdre Speaks does. Sex work was real during COVID.
Yeah.
Right.
So
Some industries never stopped.
Yeah.
Right. Yeah.
So we're at the we at the timeline on the show. So
All
Dr.
right.
Mel.
Well, thank you all. I
gonna leave
really
it at that.
appreciate you. Technical difficulties and all. Y'all were excellent. Thank you so much, Deirdre Speaks Johnson. Thank you so much, Sarah Prince. And of course, thank you for the wonderful questions, my Be Health Empowered family, and to Lila and Wayne, my fantastic co-hosts. Great show, great information. And thank you all so much for joining us. You got a little preview of what we're going to be talking about next week when it comes to oral health. So make sure you tune in. And until I see you next week, please remember to be wise, to be well, and to be health empowered. Thanks so much for joining.
Thank you. Bye.